Hello, my name is Tyler Mason. I am the bearded broker, and this is Medicare Made Simple for 2026. Now, before I jump in, I want to draw your attention to the fact that I did not require any registration from you to participate in this content. I didn't ask for your name, your phone number, your email address, your zip code, your date of birth, or anything else. I know you've probably seen the advertisements that are out there from other Medicare insurance agencies that require you to put in your contact info to be able to participate in their event. That's their prerogative to do so. I know also many folks don't want to do that because they don't want everything that comes with it. They don't want the annoying phone calls, the texts, the emails, the junk mail, or whatever else may come out of that. Information's good, but is it worth giving your information away to get it? That's always the question. So that's why I put this content together this way, is so that it's easily accessible for everybody. My simple ask is this: if the information I provide to you today is valuable, if you find it meaningful, or if you've got questions, go to the description down below where you will find a link to my personal calendar. You can book a time to talk with me one-on-one directly, and we can discuss your particular needs or circumstances. That being said, let's go ahead and let's jump in here. So there's my family. I've been married to my wife for over 20 years. We've got 6 children. Love them to death. They're my favorite people to spend time with. Outside of that, I love working with my clients. I am grateful for the opportunity to have had this exact conversation that we're having right now with over 1,000 people one-on-one. Many of those individuals went on to become my personal clients, and I have worked with most of those for years. Many of them started right where you are, coming up on 65, coming up on Medicare, not sure what to do. We walked through everything together, and I have been working with them ever since, checking in, answering questions, making sure that their coverages stay proper. So that's what it is that I do every day. Let's start first with original Medicare. Medicare Part A, this is our hospital coverage. Medicare Part B, this is our doctor coverage. Now, that is a bit of an oversimplification, but it gets the point close. The way I remember it is this: Medicare Part A is what you use if you have an emergency. Step A, get to the hospital. Medicare Part B is what comes afterwards you meet with the doctor. Medicare Part A comes with a $0 premium in most cases. As long as you worked for at least 10 years and paid taxes, or filed your taxes jointly with a spouse who worked for 10 years and paid taxes. Your Medicare Part A is prepaid. You don't have any other obligation there. Medicare Part B is not free. It has a monthly premium of $202.90. We're going to call it $203 today just for simplicity's sake. So the $203 is where most folks are going to be. Now, if you're in a limited or a low income scenario, you may qualify to have that covered by the state. I can help you with that. If you're in a high income scenario, you may be subject to what's called an IRMA, or an adjusted Part B and Part D premium. Again, I can help you with that. Most folks, however, in retirement though, are paying that $203 every month. Now, there are 3 scenarios in which you would be enrolled into original Medicare. First one is that you are already drawing Social Security, in which case your Medicare card will arrive automatically about 3 to 4 months before your 65th birth month. A lot of folks toss it because you're getting a lot of junk mail at that point. You're not sure what you need and what you don't. And the Medicare portion doesn't exactly look very official. It'll come on a large piece of paper, and it'll have a perforated tear out at the bottom. That will be your Medicare card. It'll have your name, your Medicare ID, and then parts A and B and the start dates. Okay. That is what you want to keep. So tear that out, hang on to it, keep it someplace safe. Your Medicare Part B premium of the $203 will be deducted automatically from that Social Security check. Scenario 2 is you're coming up on original Medicare, but you're not yet drawing Social Security. That's okay. But you're going to have to enroll in Medicare on your own. You can do that 3 months prior to your 65th birth month. Okay. So not counting your birth month, go back 3 months. With this one, you'll enroll either online, by phone, by mail, or in person. Online is by far the easiest. It's the preferred. It's the most convenient for most folks. I can actually send you the specific link that you will need to get to the right section of the Social Security website so you can apply online. It takes about 10 or 15 minutes. By phone, plan on being on hold for a long time to talk to somebody, and they're probably going to schedule another time for you to talk weeks down the road. In person, some Social Security offices are allowing in-person appointments. Many are still not, and they're requiring appointments, which a lot of those appointments end up being on the phone anyway. And then there's by mail, which you and I know is a crapshoot. put it in the mail, you send it, you hope somebody got it. You got to wait weeks to find out if they did or not. So online is by far your preferred method. Now, because you're not drawing Social Security in this scenario, and again, you don't have to be drawing Social Security to be on Medicare. Social Security has no place to bill, and so they will send you a bill in the mail. Now, your initial bill is for the first 3 months. So it'll be the 202.90 times 3. So it'll be 608.70 would be your initial bill for Medicare. You can actually get in front of that and request that they bill you monthly. And then my recommendation is that you set up for automatic premium payment on that, because I have seen folks where something happens, they're sick, they're out of town, whatever, they miss their bill. Next thing they know, their entire insurance falls apart because they missed a bill 4 or 5 months ago. So anyway, so that's your scenario 2, is you manually enroll in Medicare. Scenario 3 is that you are covered by insurance through an employer, either yours or as a spouse of somebody who has insurance at their employer. Now, don't just immediately discard Medicare if that is you, because a lot of times Medicare is better coverage and at a lower rate than what an employer has to offer. Okay. I've got many, many clients who have continued to work, earn a full wage, not draw Social Security, but still enroll in Medicare and drop that coverage there at work because it was just better than what was being offered. We can look at that. Your employer is required to let you know if the employer coverage is not credible, meaning that you would have to switch to Medicare even though you've got insurance through the employer, but it's always worthwhile to check. Again, I can assist with that process. Okay. The important thing to keep in mind here is enrolling in Medicare in a timely manner to avoid any penalties for late enrollment. Those penalties are lifetime. Once you have it, you cannot get rid of it. Medicare will begin on the first day of your birth month if you're starting on time. Okay. So if your birthday is, say, the 4th of June, coverage will start on the 1st of June. Okay, it doesn't wait for the birthday. It starts on the 1st of that month. Now, the exception to that, if your birthday was on the 1st of June, coverage would begin on the 1st of May. You get a bonus month if your birthday is on the first day of the month. Now, original Medicare was never intended to cover everything. It's got gaps, it's got holes, it's got out-of-pocket exposure, and there is no cap with original Medicare. Whatever your bill is yours to pay, okay? So Medicare Part A, for example, has a deductible of $1,736 per event if you're admitted to the hospital. So you could theoretically, if you're admitted to the hospital 4 times in the course of a year, have to pay that $1,736 deductible 4 times. Okay. Medicare Part B has a $283 annual deductible. So that's once per year. It only covers 80%. So you're responsible for the other 20%. And it does not cover the 15% excess charge. Now, that sounds really scary, but it's rare. The excess charge is if a doctor or a hospital accepts Medicare, but they do not accept Medicare's negotiated rate and they charge a higher amount for services, the 15% applies to the difference between those two numbers. Less than 2% of all Medicare claims in the country are subject to that excess charge, but it is there. And again, there is no out-of-pocket cap with original Medicare. So how do we build the rest of the structure around your coverage? Well, we're either going to go with the Medicare supplement or we're going to go with a Medicare Advantage plan. So if we go Medicare supplement, it keeps everything in line with original Medicare. So you got Medicare Part A and B, your Medicare supplement, properly called a Medigap, and you've got your prescription drug coverage. All of those things line up. The nice thing with this one is that any doctor or hospital that accepts original Medicare will take your Medigap regardless of who the provider of that is. So it keeps everything streamlined. Medicare Advantage plans, they're on the right side. They combine A and B into your Part C. Again, Medicare Advantage plan, Part C, same thing. So it combines them together under managed care. And the insurance carrier is the one that takes over the management of your health care. And generally, it includes Part D into it. So you get a packaged deal or you get a streamlined or a singular structure there with the Medicare supplement. We're going to look at those a little bit closer as we move forward here. So let's start first with the Medicare supplement. You're going to pay that Part B premium, the $203 every month, plus the cost of the Medicare supplement. That's going to vary based on age, gender, location. A lot of things are going to go into that, okay? But you're going to have 2 premiums, the Medicare Part B and the Medicare supplement. Then your coverage is very simple. You pay whatever it is that your Medicare supplement does not. So Medicare pays, Medicare supplement pays, whatever's left over is yours to pay. So it becomes the most predictable. Your out-of-pocket exposure is uh, almost calculated down to the dollar, depending on the Medicare supplement you go with, but it becomes very, very predictable, very budgetable this way. Network, as I mentioned, any doctor, any hospital, any clinic that takes Medicare will take your Medicare supplement, regardless of the provider. So it makes it very, very simple. Part D is not included, so you've got to add that separately with the Medicare supplement. The Medicare Advantage, on the other hand, you still have the Part B premium, that 203, plus the premium for the Medicare Advantage plan. However, Medicare Advantage plans generally have a $0 or a very low monthly premium. So Advantage plans are cheaper on the monthly basis, but you're going to have higher out-of-pocket exposure. So co-pays, deductibles, out-of-pocket maximum, all of that's going to exist with your Medicare Advantage plan. You have to go to whatever networks are negotiated by that Advantage plan or the carrier. So very similar to your employer coverage or marketplace, if that's what you've got your network of doctors. And as long as the networks are in your doctors are in the network, you're covered. Then you've got your Part D, which is typically included. And then you get extra benefits like the dental and the hearing and the vision or the over-the-counter or the fitness gym membership, et cetera. So Advantage plans come with a lot of perks that are built in. So the Medicare supplement, the easiest way to remember them, Medicare supplement is a prepaid health insurance. Medicare Advantage is more of a pay-as-you-go option. Both are great, just comes down to personal preference. Either way that you go, you're going to have some out-of-pocket exposure for both medical and non-medical related expenses. The statistical biggest out-of-pocket exposure that folks are going to have to face is going to be cancer, heart attack, and stroke. And I bring this up here for a very specific reason. Most Medicare agents are only going to look at today's enrollment. They're going to look at today's needs, and that's it. That's as far as they look. Most of my clients I meet with are 65 or close to, and there's still a lot of life left. They still have a lot of things they want to do and see and experience. And I want to make sure that folks are properly covered for all of that time, not just immediately. Cancer, heart attack, and stroke, again, these are going to come with a lot of exposure for both medical and non-medical related expenses. And that can put a substantial financial strain on your retirement and your lifestyle if all of a sudden you're hit with a substantial bill that is only partially or not covered at all by your plan. So I recommend what I call umbrella coverages. And this is the first of those, the cancer, heart attack, and stroke. Another major one that is worth considering that's often overlooked at the early stages when the time is proper to make the decision is going to be skilled nursing coverage. Original Medicare has certain criteria you've got to meet for skilled nursing to even kick in. Medicare Advantage plans often mirror that same criteria. So, for example, you've got to be in the hospital for 3 days before skilled nursing is an option. Your condition has to be improving before skilled nursing is an option. If you exceed 100 days of skilled nursing, you're on your own. There is no coverage there for anything beyond that 100-day mark. Then also, we have a couple of points here. Your doctor or other healthcare provider may recommend you get services more often than Medicare will cover, or they may recommend services that Medicare doesn't cover. You're on your own for these as well. And if you've known anybody that's been in a skilled nursing scenario, you know just how expensive and how stressful that can be. So this is something that needs to be considered early. Once you need it, you can't get it at that point. It has to have been prepared for up front. More information on skilled nursing, if you'd like to look at it in the Medicare New Handbook, there on page 29 at the top of the page. That'll give you some that basic information there that I just went over with you. So here's our umbrella coverages. Umbrella 1 is going to cover the cancer, heart attack, and stroke. That's our major out-of-pocket exposure. I recommend this regardless of which way you go. Umbrella 2, this one's going to vary a little bit. If you go with the Medicare supplement, it does not cover dental or vision or hearing benefits. So this would cover cancer, heart attack, and stroke, and then still make sure you can get your teeth checked and your eyes and your hearing and all of those things. If you go with the Medicare Advantage plan, dental, vision, and hearing are generally included with that. And so a lot of folks here want to protect themselves from their single largest out-of-pocket copay, which would be a hospitalization. So that's what that HIP or hospital indemnity plan is there for, is to cover that single largest out-of-pocket. Then umbrella 3 covers the cancer, heart attack, stroke, the dental, vision, hearing, and then the recovery care or skilled nursing facilities. That's going to be your future out-of-pocket exposure. Looking a little closer here at the Medicare supplements. So they come in a lot of different letter designations. The most common are going to be Plan G, Plan N. If you've participated in excuse me, if you've participated in another workshop, you've probably heard both of these referenced. Now, there is a third that is often overlooked, which is unfortunate because it's probably one of the most powerful options available, and that's going to be the high deductible Plan G. The thing that's nice with these is your out of pocket again is very, very predictable. You've got the Part B deductible with Plan G, the Part B deductible with Plan N, the 15% excess charge, which again is rare, but it does happen on occasion. Plan N does not cover that, where Plan G does. Plan N does also allow up to a $20 copay for anything scheduled, up to a $50 copay for anything that is an emergency. So, which one is best? It's a tough question. Really, it comes down to personal preference. So, Plan G, you're typically going to be between $100 and $200 a month. And again, that's a very rough range, and it could be more than that. It could be less than that. But this gets us ballpark, just so you've got something to kind of chew on here. Plan G is going to have the higher premium of the three. You've got the monthly premium and then that Part B deductible, and that's it. You're done. So Plan G by far the most predictable. Plan N is going to be cheaper, about $80 to $160 a month. Will give us a good range on that. Again, you've got the monthly premium, the Part B deductible, the $20 and $50 copays, and then the possibility for that excess charge, which is rare. Then high deductible Plan G, we see this one comes in at a much, much lower rate, 30 to 80 bucks a month for that high deductible G. You've got the monthly premium, the Part B high deductible, which is 2,950, and I recognize that's a lot more than the 283. But stick with me. This is where a lot of folks like the high deductible G. We can put it together with the umbrella coverage, and really you shouldn't consider a high deductible G without umbrella coverage to make sure that you are as protected as possible from that high deductible number. But the umbrella coverages pair up really well, and you can typically get a high deductible G and umbrella coverage for less than you would with a standard Plan G. And the premiums are much more stable with that high deductible G and the umbrella than they would be with the alternative options. Also, something to keep in mind when we look at these is a lot of folks look just at this, at the deductible here. But what you've got to remember is the premium of that high deductible G is a fixed amount. So you've got to look at the total out of pocket on the premium for your G or your N, and compare that with the premium and the high deductible there of the high deductible G, and it ends up actually coming out a lot closer than people think. Both are, or excuse me, all three of these are great options. Now, also keep in mind the high deductible G is not necessarily available in all states. Many states have adopted it, but again, we can chat more about that one as well. Now, the best time to enroll in your Medicare supplement is going to be 6 months early if you can. Some carriers will let us do that as far as 6 months out. Others, it's 4 months out. But regardless, the sooner we can get enrollment taken care of, the better. One, it locks in your rate. Two is it just avoids mistakes and stress of trying to do it all at the tail end. So getting it done early is generally a preferred way, just to take that off of your to-do list, get it off your plate. And again, the plans are all standardized. So they're a G as a G regardless of provider. So the providers themselves are not all the same. So there are some things to keep in mind as far as the providers go. You don't just want to look at lowest premium, but there's really no reason to worry about a particular brand loyalty because you've always had somebody. They may be $50, $60, $70, $80 more per month for exactly the same coverage with somebody else that's just as reputable, and they're going to give you exactly the same letter designation. So those are the things that we look at. Now, as far as providers, I represent a wide range of them. This isn't everybody I represent, but this gives you a pretty good idea. Some names on here you'll recognize for sure. Names like Aetna, Humana, Mutual of Omaha, United Healthcare with AARP. There's a lot of carriers and providers that I do represent as an independent broker. I don't work for any of them, so I am able to represent all of them equally. Some common myths that people have when it comes to working with a broker. The first one is that I will charge some sort of a fee. I couldn't even if I wanted to. As a licensed agent, I am prohibited for charging for Medicare related services. So there are no fees. So if you were to book an appointment with me for a consultation, there's no fee for that. If we were to find coverage that's appropriate and I help you with the application process, there's no fee for that either. And then the ongoing support, you call me, we have to make adjustments, you need questions answered, whatever. There's no cost for any of that either. So there are no fees for my service. Second common myth is that you'll get a cheaper rate going straight to the insurance carrier. And again, that's simply not the case. The insurance carriers have their rates. Those rates are extended to their brokers or their agents in the field. And then we are all offering exactly the same premium for the coverage. The difference, if you go directly to an insurance provider and enroll with them directly, your agent is now a 1-800 number and whoever happened to pick up the phone after you wait on hold forever, versus working with an agent or a broker like myself, where you've got my personal number. You call me if you've got questions, you get the answer that you need, you move on with your day. The third myth is that the insurance carriers in some way influence my decision making. All of the insurance carriers pay me exactly the same way. So from my perspective, it doesn't matter to me. It comes down to which provider is going to give the best service and the best rate to my client. And I'm able to use whichever one makes the most sense without influence or oversight from some insurance agency putting pressure on me to do more of this or less of that. Let's look at prescription drug coverage because remember, we've got your original Medicare, we've got your Medicare supplement, and then we've got prescription drug coverage are all going to be those necessary components. Now, this one's important. Prescription drug enrollment late penalty. If you do not enroll in your prescription drug plan once you're eligible to do so, and you no longer have credible coverage, and that's important. If you no longer have credible coverage and you're eligible for your prescription drug plan, you need to enroll in it, because if you don't, you incur a lifetime penalty of 1% of the average annual Part D premium per month. Okay. So that Part D penalty is permanent and it changes from year to year based on the national average for the monthly Part D premium. Okay. So it's definitely worthwhile to do it. For example, if you were to be eligible in January, but you don't enroll till the next January, you've incurred a 12% penalty, and that is for life. So here's how we go through and we look at prescription drug coverages. We take all of your maintenance medications, everything that you're currently taking and using, that goes into an online calculator. We put in the preferred pharmacy that you use, because just like doctors, pharmacies could be in or out of network. So we want to look at that. And then we compare all the plans that are available in your zip code. And there's going to be a number of them. Once we find the proper plan, then we enroll in that. And then every single year, we reevaluate to make sure you have the proper prescription drug coverage. That happens between October 15th and December 7th. That'll just be a reoccurring event on your calendar. We'll just plan to do that every single year during that roughly 2.5-month window. And then you know for sure that you are properly, or 2-month window, you know you're properly covered. All right. So again, recap. If we go original Medicare, you got Medicare Part A and B, your Medicare supplement, and then your prescription drug coverage. And then the umbrella coverages that go with it. Umbrella one at a minimum, because that's going to be your single largest out-of-pocket exposure for the highest statistical event. Okay. All right. Let's look at the Medicare Advantage plans here. With Medicare Advantage plans, as I mentioned, you are opting out of original Medicare. You are choosing to have a private health insurance company manage that healthcare. So they have to include all the same things as Medicare Parts A and B. Medicare Advantage plans can't just say, well, we're not going to cover something. If Medicare covers it, your Advantage provider must cover it also. And then most of your Advantage plans will include prescription drug coverage built right in, packaged together. Plans as low as $0 per month. Some Advantage plans will have a premium, $10, $15, maybe $20 a month, but typically not very expensive if they do have one. And you do still have to pay that Medicare Part B premium of $203. Now, as far as coverages, you're going to have copays, deductibles, coinsurance, out-of-pocket maximums, and that's where we recommend that hospital umbrella coverage for Medicare Advantage plans, because your single largest copay will be a hospitalization. Advantage plans vary by zip code. So one of the biggest mistakes that people will make with their Advantage plan is that they will just assume that because their brother, sister, friend, whatever has a plan, it must be a good one. But if their plan is in a different zip code, it may not be available to you. Or if it is available to you, it may be different than what's in their zip code because they do vary geographically. We want to look first at the doctors, the medications, and the hospitals. Before we look at any other benefits, we want to look at those things first. Maintenance medications are things you take every single day. We want to make sure those are properly covered at the best possible rate. Doctors are the people you trust to assist you with those medications. So we want to make sure your doctors stay in network. And then if you have a preferred hospital network, making sure you keep those. So that's our biggest criteria when looking at an Advantage plan. After that, then we can look at the benefits. Do they have a gym membership? What does their dental look like? Do they have an over-the-counter allowance? Do they have any other perks or benefits? Those are all secondary to making sure that the doctors, hospitals, and medications are covered. Now, your initial enrollment starts 3 months prior to your 65th birth month, as I mentioned. So that's when you'll start. And then every single year, we have our annual election period, AEP. That happens between October 15th and December 7th. Every year, carriers put out their new plans. They are required to be published on October 1st. That gives me about 2 weeks to review all of those and make sure I know exactly what they've got coming for next year. And then October 15th to December 7th is my time to check in with every single one of my clients and make sure that they are properly set up for the next year. And I'll put you in that exact same rotation. We'll make sure that we look at medications, see if they've changed. Look at doctors, see if anything's changed there. See if any medical conditions have changed. Is there new care that you require or something else that's going on? Is there anything coming up the next year we need to make sure that we're prepared for? Any increase in labs or tests or services or things like that, right? These are all the things we look at when looking at coverage for the next year to make sure that you are properly set up. And then you will never have to worry about whether or not your coverage is proper. You'll always know that you are ready for whatever is coming. Okay. So again, side by side, we've got the Medicare supplement, which is our prepaid health insurance, our Medicare Advantage, which is more of a pay-as-you-go option. By this point, you should have a pretty good idea of which of those is feeling more comfortable to you. Now, if you don't, that's fine. We can plan to chat and we can go through them, more specifically with your questions so that you can better isolate it. But by this point, a lot of folks are starting to know, I kind of prefer that Medicare supplement and its convenience and predictability, or I like that Medicare Advantage plan with the packaging there and the extra benefits. Then also we've got those umbrellas. By now you should have kind of a sense of which ones sound good. Now, of course, there's no commitment you need to make yet. We can look at providers and rates and all of those things. But I do recommend at a minimum that umbrella one, because those are the single biggest out-of-pocket exposures that folks will run into, even with their Medicare coverage. Now, I'm just going to put a bookmark in these. I'm going to mention them very, very quickly, and we're going to move forward. We've talked a lot about protecting your health insurance. But what a lot of folks don't think about is protecting their financial health. So there are ways to protect your money. So if you've managed to put together a 401k or an IRA or a 403b, you got money that's in mutual funds or is in a savings account or wherever, and that's part of your retirement portfolio, a misstep at this point could be catastrophic, could really change the way that you look at your retirement. So there are ways to be able to protect that. And we can make sure that you have access to all of the principal there. It can continue to grow. So there's a lot there. If you want to talk about those, we can get into more detail. Again, I don't want to spend a lot of time on this, but I do just want to mention this is one of those things that I look at from a holistic approach as folks come into retirement, is making sure that they are prepared not only to take care of their medical, but also protecting the finances side. And then the final one I'm just going to mention here briefly is the life insurance side. A lot of folks have a life insurance policy through an employer, or they've had a term policy they've had for a number of years. Term is great for when you've still got a mortgage, you've still got car payments, you've got student loan, you've got dependents at home, you've got a spouse that you want to make sure doesn't have to go back to work, whatever. Term's great for that. As we get into retirement, then we start to look more towards whole life policies, things that are not going to go away. Whole life is primarily there for covering final expenses so that your loved ones don't have to worry about it. Maybe you want to leave something behind to a spouse or children or grandchildren or to the estate. Or in some cases, you're just looking for a wealth transfer. You've got money that you know for sure is going to go to somebody or a group of people or to an organization. Whole life policies are great ways to do that. So I do frequently review life insurance coverage with my clients as well, so that they can just evaluate what they have and see if there's any changes that need to be made. Sometimes there's not, sometimes there are, but then at least you know for sure what you have. So if you'd like to talk about that, again, we can plan to do that. From here, next steps. First phase is getting information. We've done that. We've gone through, we've talked A to Z, top to bottom, what Medicare is, enrollment windows, options, and those things that you need to be considering, not just for today, but for 10, 15, 20 years down the road. Next phase is to schedule that consultation. Again, description down below, you'll find a link to my calendar. Take advantage of that. You'll be talking with me personally, one-on-one. After that, free ongoing lifetime support. You got questions, need to make changes to coverage. If we need to adjust anything, you've got my personal direct number. You call me, we chat, we make the adjustment, you move on with your day. Also, the free annual reviews. If nothing else, we'll talk at least once a year just to make sure everything looks good for the next calendar year and you're not worried about whether your coverage is going to be the proper fit or not. So thank you so much for taking the time to go through all this. I know that there's things that you would have much rather do than sit here. I appreciate that you gave me personally that time. I look forward to being able to give back to you by helping you plan out those next steps. So again, book that call, and I look forward to seeing you on my calendar.